Well, welcome to the Flying Eye Hospital, and thank you very much for applying for the position of staff ophthalmologist. It is probably one of the most unique opportunities in medicine. Not only do you get to work with some of the best professors and trainers in the world, but you get to go to some of the most unique places and see the challenges and systems in place to improve the eye care in those countries. As the staff ophthalmologist, not only do you supervise patient care and assist the professors with post-op exams, pre-op assessments, and paperwork, but you also help follow these patients and go back to check on these patients 6 weeks after the plane's departure in what we call the surgical case review. At least 2 times during the year, you will be the lead ophthalmologist, where it is your job almost 8 months in advance to start building relationships with the partners, starting to design and tailor the training and skills exchange conferences necessary to deliver a high-quality 2 to 3 week program later that year. It's a very challenging position where almost any and all aspects of patient care and conference or event planning fall on your plate. I will tell you that as an ophthalmologist and as a physician, this position definitely improves your logistical skills, your cultural sensitivity skills, as well as your organizational and programmatic thinking skills. While the staff ophthalmologist position is a very exciting position where you get to work with some of the world's best professors and travel to very unique countries and work with excellent hosts, it's a very challenging position. You work 14-hour days, you ride long buses to the airport, you have to clean the plane at the end of each day, you have to organize patient charts, you have to make sure that the patients are checked in and tucked in each night. Not only do you have the challenges of the workday, but then also you have the challenges of traveling throughout the year. You may travel as much as 35 to 45 weeks a year, traveling multiple flights to get to some of our destinations. I do think that the rewards of this job greatly surpass the challenges, but I think it's very important for everyone to realize that there are very humbling and challenging parts to the job, whether that be packing the plane, cleaning the plane, getting everything organized for screening day, being the last ones to leave screening day, entering patient data into our electronic medical records, following the paper charts, as well as ensuring that our patients get all of their care. At the end of the day, your job is to make sure that we have the best training program and patient care program possible, and all the logistical and all the clinical details that involve ultimately become part of your job responsibility. I do want to make sure that every applicant knows that this is a non-surgical position, that you will do clinical exams and post-op exams, but it is the volunteer faculty who operate, that you will be asked to do things that you were never asked to do in medical school or residency, whether that be cleaning the toilet or vacuuming at the end of the day, or packing a DC-10 plane, or acting as a flight attendant. All of these things, while they may seem difficult or beneath someone at the beginning, actually become some of the best parts of the job, becoming part of the team, part of the flight crew, and really understanding all the demands and all it takes to pull off an excellent ORBIS training program.